Exertional heat illness typically occurs during summer workouts during activity over a prolonged period of time. These illnesses include heat syncope, heat exhaustion, and heat stroke. When you notice an athlete experiencing symptoms such as excessive fatigue, dizziness, and a sudden collapse, you should implement your emergency heat illness plan. In order to determine a differential diagnosis, the athletic trainer must take a rectal temperature. To do this, you want to move the patient from the field they are on and lay them on their side. Ideally, you'd want another person there using something such as a towel or a sheet to establish privacy, and someone else to hold the patient in place, especially if they become combative. Once you sanitize the thermistor, you want to turn it on and insert it 4 inches past the anal sphincter and secure the probe using tape or the patient's clothing. Once it is in, it should stay in for the remainder of treatment, and vitals should be observed every 5 minutes or so. With heat exhaustion, a patient is usually experiencing fatigue, dizziness, pale skin, cool and clammy skin, or hot and wet skin, collapse, and dehydration. Their core body temperature will also be less than or equal to 104 degrees Fahrenheit. With heat stroke, patients may experience the same symptoms as they would with heat exhaustion, including CNS dysfunction such as personality change and combativeness. The biggest differential is a core body temperature of 105 degrees Fahrenheit. When treating exhaustion, you want to move the patient to a cool, shaded area, remove their excess clothing, and begin cooling with ice towels. With heat stroke, you want to move the patient to a cold water immersion tub with ice to begin rapid cooling. This should be done with as many people available to assist. Their core temperature should decrease by a rate of 1 degree Fahrenheit every 3 minutes. You want to leave the patient in the cold water immersion until their core temperature gets down to 102 degrees Fahrenheit. While you should call EMS immediately, it is important to keep in mind that you should cool first and transport second. Death from exertional heat illness is 100% preventable if recognized and treated properly as soon as possible.